R is for the rabies vaccine. And this seems pretty simple. You might be thinking, this seems kind of lame, but actually this is a really common question that I get. And the question comes from the fact that as I'm talking, I'm realizing I didn't verify this dose before I started talking. So verify, trust but verify. The dose for the rabies immune globulin, and unless you have a patient that's getting like multiple bites, multiple times or whatever, which maybe could happen in various professions or whatever. But if you have a patient that's just like a one-off for a rabies vaccine, every patient that gets a rabies vaccine should get a rabies immune globulin. And so the rabies immune globulin, and I should have verified this before I started talking, but I'm pretty sure the dose of that is 20 units per kilo. And it's either 900 or 1500 units per ml. It comes in two different varieties. Again, verify that, trust but verify. So my point is you're going to be giving multiple mLs of drug IM. And oftentimes it's in really small spaces. You're giving it on like a finger or like a skull or a place that doesn't have a whole lot of like muscular tissue to give an IM injection. And so the question I get a lot is, I know I'm supposed to give it around the wound if possible, but I don't have enough tissue to do that. I'm supposed to give 3 mLs and it's on a thumb. So where am I supposed to give it? And it should, the vaccine should be given opposite the wound. So if I'm bit on the right hand, the vaccine should be given on the left side, and the immune globulin should always be given on the opposite side of the vaccine. So the vaccine is opposite the bite, and then the immune globulin ideally is around the wound. The question I get though is, well, what if I can't get it in around the wound? The thumb's too small, the skull, doesn't take an IM injection. And so where do I do it at? And the answer is just the opposite appendage of the vaccine. So the immune globulin is ideally around the wound. If I can't do it around the wound, then the vaccine is on the opposite side and the immune globulin is on the same side as the wound, just the opposite of the vaccine. I hope that's not too confusing. The other things I want to say about the rabies vaccine and immune globulin that aren't super obvious is that the incubation period for, I wanted to say gestation, that's not right. The incubation period for rabies can be up to a year. And so even after the wound or the bite has healed, I've had patients come back and be like, someone told me I should have gotten this rabies vaccine back when I got bit by a dog, 6 months ago. And we're oftentimes quick to brush that off. But the reality is rabies can actually stay in the system dormant that long. And there's only been one documented case of any human ever in the history of like the world ever surviving rabies once they became symptomatic. So they absolutely should get the vaccine even if it's that long after the bite. The other thing is patients, especially from bat exposure, may get a rabies vaccine and immune globulin if there's no visible bite. And that's because bat bites can be very small and we may not even be able to see the actual spot where the little vampire creature did the bite. What else do I want to say? Dirty wounds and animal bites actually often are also indications for a tetanus shot. So your patient who comes in and got bit by a dog and is out of date on their tetanus shot will actually be indicated for a tetanus shot that day too, and we don't always realize that. So things you don't always realize about rabies vaccines. The vaccine should be in the opposite arm of the bite. The immune globulin should go around the wound if possible. If not, on the same side of the body as the bite. Can happen up to a year after the bite because the rabies can lay dormant. And then a tetanus shot is also oftentimes indicated. So there you go, guys. You didn't think I had anything to say. I always have things to say. R is for rabies, Farm ER.